What food should you avoid if you have gout? If you've ever had gout or you're currently dealing with that, then you probably know that foods are generally the culprit, but you may not know what foods to actually avoid. If that sounds like you, then you are in the right place because I'm here to answer that question in today's video. Let's get started. Hi, I'm Dr. Kelly Shockley, Doctor of Cause Chiropractic, board certified in sports medicine and specialized in clinical nutrition. In this video, we're going to cut right to the chase and I'm going to share with you the supreme list of foods you should avoid if you have gout currently or if you don't ever want to deal with it again. Then we'll be covering the most common mistake you're unknowingly making when it comes to eating to avoid or heal from gout. And finally, I will be sharing with you a little known strategy for ending gout once and for all. You won't be hearing about this approach from your medical doctor, so let's dive on in. If you've had gout and you need to know what the answer to this question actually is, what is the supreme list of foods you want to avoid like the plague if you're dealing with gout or to not end up with gout again? I'm going to list them off for you, all right? Here we go. Alcoholic beverages. That one you've probably known about. Shellfish, bacon, turkey, drinks that are high in sugar. So all of your pops or your sodas, juices, veal, organ meats, salmon, chicken, beef, especially if it comes from sources that have been adulterated, codfish, some vegetables, okay, like broccoli, leeks, yeast, and shrimp. There's also certain fruits, but we're going to talk about that one soon. That is your ultimate list. Like, avoid all of those if you have gout right now, and you'll be decreasing the substances that the body actually converts to uric acid, which is what is happening in your big toe, most commonly, or any other joint that you actually have gout happening is there's uric acid crystals that are actually getting stuck in the joint, which is why it's so painful to move. That's why it gets red and swollen and really angry looking. So these foods you want to cut out immediately. Now, avoiding them ongoing, not necessarily. I mean, a lot of those are protein sources, but when you consume proteins, you want to make sure they're coming from clean sources, meaning the way that God intended those animals to be raised. They're not injected with hormones, they're not injected with antibiotics, they're not consuming things that they were not designed to eat, okay? That will help you, and then you can still eat your protein. Now, did you know that all of those foods are the ones that you should be avoiding while you have gout? Let me know your answer in the comments down below. What is the most common mistake you're unknowingly making when it comes to eating while dealing with gout? It's not avoiding fruits or sugars that come from fruit, or other versions of high fructose like corn syrup, right? Here's the thing. What I see as a more common precipitator of gout in today's world is fructose. Whether that is coming from consuming lots of fruits itself or the chemical man-made version of the high fructose corn syrup, okay? Fructose is better than high fructose corn syrup, but at the same point, neither one of those should be consumed in high amounts. Not only can they precipitate gout, but they can wreak havoc and create all kinds of other issues. In fact, it's been said, consuming high amounts of fructose, whether natural occurring from fruits and fruit juices or the high fructose corn syrup version, is actually worse for you from a health standpoint than if you're an alcoholic. So no joke here, it's not good. I have worked with patients with gout and they've cleared out the rest of the food that I've shared with you, but they're still eating fruits and they're wondering why they're not getting better, okay? So it's the sugars and fruit sugars, natural occurring sugars, that really seem to be a bigger, more common problem amongst my patients than the rest of that list. So make sure you are cutting out sugars, really in all forms, while working to heal back up from gout. And then when you get on the other side of gout, don't eat sugar in mass amounts. Don't eat fruit in mass amounts. If you enjoy fruit, have one serving of fruit a day, and that'll help you steer clear of ending up with gout again. Now, before I get into this little known strategy that'll help you end gout once and for all and never have to deal with it again, right? I just want to take a moment and ask you to subscribe to this channel, okay? Click the subscribe button, turn those notifications on, and while you're down there, give me a big like. I am regularly producing videos for you, teaching you how to improve your digestive system, your immune health, brain health, you name it. Everything to help you be able to take back control of your health so you can achieve what I like to call total body mastery. So again, just a reminder, click that subscribe button, turn the notifications on, and give me a big like while you're down there. I appreciate your support greatly. Okay, what is this little known strategy for ending gout once and for all? It's actually finding and treating the underlying cause. So here's the thing. Diet is a huge influence with gout, but there are other things that are probably not working the way that they're supposed to that allow this to be a higher occurrence for some people versus others. So ultimately, when I approach somebody's health, I look at their whole entire body's health, and I evaluate every system that's in the body, and I evaluate for inflammation and low levels of infection that they don't even have symptoms of. I evaluate for toxicity. Like, we do a deep dive through the health to figure out, where are we having problems? Where are things working at a suboptimal level that might make your body not process the breakdown of these foods more easily than others, okay? When we go through and we look to see where's the inflammation, where's the infection and all of that, when you're working at a suboptimal level, you're also probably dealing with different imbalances and different deficiencies that, again, are going to compound your body's ability to process what you're actually putting in it. Okay, so figuring out the imbalances, the deficiencies, if there's inflammation or an infection, if there's toxicity, has major influence over your likelihood of ending up with gout again or not. So how in the world do I do that? I'm so glad you asked. That is a whole other topic in and of itself, and I want to be mindful of your time. So what I've done is I've put a link in the description right below. So click on the description, have it expand, scroll down, look for the link to my health workshop. Click on that, and you will have instant access to really understanding how to figure out the underlying cause, like what's not working right in the body, what's setting you up for this outcome, because maybe you and maybe your significant other eat the same, but you end up with gout and they don't. So why is that? We're all different, right? So by the end of the workshop, not only will you have a full understanding of what's causing and how to figure that out, your gout, but you'll also have an understanding of what does it look like to start unwinding that and to put yourself back together so you don't have to deal with this ever again. I can't wait to see you in the workshop and on a future episode. I hope today was super helpful for you, and we'll see you again. God bless.